All right, good afternoon to everybody. Thank you for joining us. As Courtney said, I am Karen Reece. I'm a registered dental hygienist. Many of you may have encountered a hygienist or two in your life at the dental office who cleans your teeth and does preventive care for you. I titled this Oral Health and Success for Generations, mainly to drive home the point that you have choices in your life as to if you're going to take care of your oral health or not. And those choices are going to affect you for the rest of your life and also your children's lives. So let's get started. My first comment is healthy people do get to do what they enjoy in life. If we feel good, if we have health physically, in our mouths, orally, and emotionally, life is just easier for us. And you can go achieve what you want to achieve. When we have good oral health, we have good general health. And as a result, you have confidence in yourself. You have better earning potential in the world, and you're more productive in all of your life activities because you have energy at home, school, work, and play. Lack of oral health. Consequences can be big. You miss school and work days due to being in pain or discomfort. You have to miss days to go to doctor appointments, dental appointments. There's an expensive cost involved for dental care and health care. It's also, oral health is also linked to systemic diseases such as diabetes and heart disease. You lose money by not working, and you can lack confidence, energy, and your ability to focus. So there's a lot to think about. It's not just brushing your teeth and making them look pretty. So what does good oral health look like? All right, this is your Hollywood smile that most of us don't have, but there's a lot of things to be said here. If you will look at this person's teeth, they're generally a white color. We do not all have teeth that are this white, but white is the natural color of enamel, and it can vary. But clean teeth, healthy teeth don't have yellowing, don't have black marks. And if you'll look at the gums, I want you to look at this knife edge point between every tooth, very sharp. And we'll talk about that more later when we're talking about gum disease. With gum disease, that knife sharpness is not there. It's enlarged and it's red and it's round looking. So that's a good general idea of what a healthy mouth looks like. All right, so unhealthy mouth, dental diseases, cavities, which probably most of us have heard of. Maybe you've had a few cavities. Gum disease, which is very prevalent in America. There's over 60% of the population has some form of gum disease, and many people don't even know it. And oral cancer, which is also on the rise because of habits. And we'll talk about some of those habits later and things you could try to avoid. So here's some photos. This one's a little blurry. I apologize. This is a child's mouth who has a very large cavity. Most likely this is painful. But cavities can be small. Little tiny black dots like this can be cavities also. And of course, that's pretty obvious. This rampant tooth decay, the black areas, the gold areas, and even the areas that are a little whiter than usual mean some breakdown in the tooth enamel. All right, this is a cross section of a tooth. So if you can imagine, if I draw a line across here, everything below it is under your gums. You don't see it in the mouth. Those are the roots of your teeth that keep your teeth in your head. And then the top portion is the tooth itself, and we've sliced it in half and opened it so you can see what a cavity looks like inside. A cavity usually starts like a triangle. It's this little black area. And at this point, you probably don't know you have it. You probably can only detect it through a little bit of discomfort. It's not going to be real uncomfortable at this point. So a dentist with dental x-rays can pick up on it like this. And that's why it's important to go twice a year and have some x-rays so they can pick up on something while it's this small and very fixable and not real painful. So as that cavity progresses, as the cavity progresses and gets bigger, it hits this yellow area. So the white area was the pretty enamel, that pretty pearly stuff that we see. It's the hardest substance in your body, even harder than bone. The yellow is dentin. It's a little softer. It's more like a sponge. So when that cavity hits it, suddenly it grows and it grows fast. This red area is the nerve of your tooth. So as you can see, this black area is getting closer, not too close, but at this point you're feeling it. You're feeling that cavity. As it gets bigger, if it's left untreated, we're getting really close to that nerve. This one would hurt. You would feel it with chewing, cold air, cold water, sweets, might just throb on its own, hurt. And if left untreated, it is going to get into that nerve and ultimately travel down and cause a big infection down here, which requires dental surgery to repair. So that's why prevention is important and catching things early. We'd rather catch it at this stage than wait till this stage when it becomes painful. It does produce an odor, and it costs a lot of money. It takes a lot of time to fix something like that. Oops. Okay, so to get a cavity, there's a formula I always tell everybody to remember, kind of like simple math. Plaque plus sugar creates acid, and over time, that creates a cavity. So if we remove one of these factors, the plaque or the sugar, we're not going to get acid and we're not going to get a cavity. So remember that if you eat sugar and you brush your teeth right away and you get it off your teeth, you're going to be all right. Or if you have a lot of plaque and you remove it thoroughly, you're going to be all right. But if we have plaque and sugar, we're going to get acid, and that acid eats away over time. So plaque is in all of our mouths. Nobody can avoid it. God made us this way. I always wondered why, because it basically is self-destructive. The plaque is bacteria, which you can see in this microscopic image. It's mixed with the food in your mouth and your saliva, and it forms a material that I'll show you a picture in a moment. But if you can imagine, this is all live moving stuff. That's just a photo. But if it was under a microscope, yes, we have moving bugs in our mouth at all times. And some of us have more than others. If you'll take a look at this picture here, plaque is this white creamy stuff. It often builds along the gum line, but it can also come in between the teeth. It can be on the front of the tooth, creates that yellowy look, takes away that nice, white, shiny, pretty, healthy look. Here's a nice glob of it up there. And look over here what the plaque is doing to the gums, the redness. We'll get into that a little more, but just notice that. Okay, people of color might have pigmentation on their gums. That's this side. This side over here is a white person. But all in all, healthy gums still look the same. Very sharp, pointy between each tooth. Teeth whitish in color. Okay, so the second part of the equation was sugar, and sugar hides in a lot of places with carbohydrates. It can be in the most common things we think of, like cookies, sweetened cereals, candies, all those yummy Starbucks drinks are, and sodas. Sodas are a double whammy because not only do they have sugar, they have carbonation. Carbonation is created through something called carbonic acid. And as we talked about earlier with the equation for cavities, acid eats away at the teeth and creates cavities. So you have sugar and cavities, and acid, excuse me. Any questions so far? We're good?
No questions in the chat box, but y'all remember, participation's required.
I have a question, please.
Yes.
Can it be like when you have cavity, can you transfer it to someone else by kissing or something?
Generally, no. Now realize what's causing the cavity is bacteria in your mouth. So yes, anytime you kiss someone, you share bacteria. Not necessarily going to cause a cavity, no. But
Okay.
a clean mouth is definitely more preferable for kissing for many reasons. For many reasons, for health reasons as well as other. Does that answer?
Yes, thank you.
Okay, good question. Logical.
Hello, good day. This is Chantel. I have I guess a quick comment because I had asked something you just said before as far as brushing right after, and I was told that even though I brushed right after, the damage still was done. But then I'm happy to hear from you that you can go ahead and do that and then it helps, because I thought that made sense, but I was told otherwise. So thank you.
Okay, thank you. We can't repair teeth once there's cavities, but you can stop the progression and add some mineral back into the cavity is just a soft spot in the tooth, if you can imagine that. And if you're brushing with the toothpaste with a high content of fluoride, fluoride's a mineral that helps harden it. We can't repair the enamel, but we can slow it down. We can stop it until you get to a dentist and get it fixed. So it's always beneficial to brush, always. Does that answer? Are we good?
Yes, thank you.
Okay. All right.
We do have a few questions in the chat box.
Okay. And I can go back.
Someone said brush your teeth twice a day, so that's actually not a question.
Right. We'll get to that,
we
but great comment.
We do have one that says, what's the best thing to treat your mouth? And someone else said, should we rinse after brushing?
Aha. Well, rinse after brushing was something I grew up with. And then when I got into dentistry and really more recently found out that you should spit, but not rinse. Now, you don't want to swallow toothpaste because it can upset your stomach, but ideally you spit out as much of it as you can, and then residual will help mineralize the teeth, make them stronger.
Yeah, I learned that in the last couple of years too. Like, don't rinse your mouth after you brush. I do have one other question, and then I'll let you get back to your deck.
Okay.
The question from the student is, basically they heard that using mouthwash causes cancer. Is that true?
Causes cancer? No. No. Especially if it's a good mouthwash, something that's approved by the American Dental Association. It should not cause cancer unless you're doing it maybe 25 times a day or some outrageous amount, but mouthwash twice a day in the morning and then at night is great, particularly one that's got fluoride in it.
Awesome. Thank you. I'm going to let you get back to your deck, and then we'll come back to the questions that are starting to pop up.
Sure. Great.
Okay.
Good questions. Good questions. All right. So since plaque was the first part of that equation with dental disease, we have to control it. And there is a correct way and a not correct way to brush your teeth. And several of the students mentioned brushing twice a day. That's important, particularly before bed at night. If you can only brush once a day, I would say do it before bed at night. That way, the food you've been eating all day, the bacteria that's been building up all day is removed before you sleep and when your mouth is still and gets a little more dried out. And so you're less likely to create cavities if you'll do it at night. If you'll notice the angle of the brush, let me point out here and here, we call that a 45-degree angle. There's a lot of people that are afraid to brush directly at their gums because we used to think that over-aggressive brushing caused something called recession. But it is safe if you're using a soft bristle brush or if you have an electric brush. All the electric brushes, the circular Oral-B one, I use a Sonicare, which looks more like a traditional head. Those brush heads are all very safe. They have studied how they affect the gums, and there is no reason to believe they would hurt the gums. So if you're using an electric brush, you're going to just place it right there at the gum and hold it for a few seconds, and then proceed forward. and make your way all the way around your mouth. If you're using a handheld brush, you're doing a back and forth short stroke, half an inch back and forth. You don't want to scrub the whole side at once like this. That is when you can cause some damage. So little short back and forth strokes. Point it at the gum, every area of the mouth, including the inside, which this is trickier, and you see that. You can put it down in there. In the front, you come in more from a vertical angle, front on the top. And then very importantly, go back later with your toothbrush and brush the chewing surfaces of the teeth, because that's often where cavities will start. So chewing surfaces. This should take 2 minutes, and 2 minutes seems like an eternity when you're brushing your teeth. And I always tell little kids to, you know, if mom and dad have an egg timer, or, you know, everybody's got phones, put a song on for 2 minutes. It'll go a little faster, or it'll seem to go faster. The electric brushes have 2-minute timers on them, but it has been proven that you cannot get all the plaque off your teeth in under 2 minutes. What happens is most people scrub really hard and really fast, thinking they're going to get it that way in a short amount of time, and they don't. They miss half of it, and they wind up causing damage. So it takes time. And once you've learned to slow down and really look at each tooth as an individual tooth, not as I'm going to just get my whole mouth or a whole side of my mouth at once, it starts to make more sense. Any questions about toothbrushing? Nope.
All right, I'm going to go back to the chat box.
Okay.
Sorry, you said we shouldn't rinse out, we should just spit out, right?
Correct. Yep.
Okay.
Spit out as much as you can. And keep in mind too, when you're brushing your teeth, you know, on commercials on TV, they show that nice big ribbon of toothpaste, like on this visual here. You do not need that much. A tiny pea size, maybe a quarter of this, what they're showing on this picture here, is all you need, because it spreads and it gets mixes in with your saliva, and enough of it gets in your mouth. It's not a more is better type thing necessarily. So by the time you're done, if you've only got that small amount, you don't have a large amount of foam in your mouth that you're having to try and expectorate. It's usually pretty easy to spit a few times. Usually I'll spit, I'll go maybe wash my face. By the time I'm done washing my face, I need to spit again. And usually by then it's all out. Try not to swallow it. It can upset your stomach, and especially with children. And we'll talk about that in a little while too.
Let's see. This one's a comment. I have a bad tooth that's decaying, but I breastfeed. I can't do anything until I get insurance. We'll see if we can find some community resources
Yes.
as far as insurance is concerned.
Yes.
Let's see. I have gingivitis since I was younger. Is there a cure for it? Because all my dentist gave me was an oral rinse after brushing.
Okay. Yes, curable. That's the nice thing about it. And it really just has to do with plaque control, doing better with your brushing, your flossing, going and getting regular cleanings, because the hygienist can get to places you can't. But yes, gingivitis is very curable. And hopefully the student's hygienist has gone over brushing and flossing techniques with them.
The chair. Mm-hmm.
And it might be the student might be someone who develops more plaque than others. Like I said, we're all different. Some people are like factories, and just their mouths just build a lot of plaque through no fault of their own. But that just means they have to work harder to keep it away.
Let's see. Is it good to use mouthwash?
Yes, it can be good. It's not always necessary, but if you like it, it's not hurting anything. It can be beneficial if it's an antibacterial, like a Listerine. It kills some of the bacteria in your mouth. Or Listerine also makes mouthwash with fluoride in it. And that's really good, because fluoride not only makes your teeth stronger, but it also kills bacteria.
Okay. There's a question here about veneers. I'm going to ask that student to ask that again at the end, since we're talking about brushing primarily right now.
Sure.
So
Sure.
student, if you will just ask that again at the end. I don't want to call out your name in case you wanted that anonymous. Let's see. We just talked about rinsing after you brush. Let's see. Oh, someone said brushing twice a day for 2 minutes reduce their tooth pains. High five.
Yeah, see, you see results. Yeah.
Is it okay to brush your kid's tongue?
Yes. And it's a good thing to do.
Awesome. There's a question about floss, but I feel like you're going to get to flossing
I will.
momentarily, so we're going to skip that one.
Okay.
Uh,
Yeah.
oh, they asked the question about brushing their child's tongue because each time I brush my 2-year-old's tongue, it bleeds. Oh, no. Oh,
Oh no, maybe you're
let me
brushing
take
too
that back.
hard. Yeah.
Yeah. Woo,
He's
it
a
should not be bleeding,
little.
baby.
And an option, okay, if we're talking about only a 2-year-old, a little person, another option instead of brushing the tongue would be what I'm going to teach them to do for infants anyway, is to take a wet washcloth, wrap it around 2 fingers, and wipe the tongue with that. So
Yeah.
that way you're less likely to hurt them, because if you hurt them, they're not going to want you to do it. And they're
Right.
going to grow up hating having their mouth cleaned. And that's, we want to avoid that.
Right. Is it safe to use kids' toothpaste for my 2.5-year-old daughter?
Yeah, we were going to talk about that later, but I'll go ahead and say if she is a good spitter, if you feel like she's not swallowing it when she brushes, and if she can spit it all out, and really with kids, if you need to add water and swish and spit, just to keep them from swallowing it, that's okay. I mean, preferably they shouldn't rinse, but kids are very sensitive to fluoride. We don't want it getting in their tummies.
Let's see. It looks like the rest of the questions are like water flossers and flossing. So I'm going to skip those because you're going to
Okay.
get to flossing momentarily.
Yep.
Let's see. Oh, now this is a very specific question.
Okay.
What would you consider as the most effective and least invasive treatment for gum disease, the black triangle? What do you think of pinhole technique? Will the result last? Whoa, that's very specific.
Wow, that's someone who knows a lot. Maybe has
Yeah.
been more periodontalist. As far as I know what pinhole technique is. Every mouth is different. And that's kind of the important thing is to get to your dentist to be diagnosed. And if they send you to a specialist, a periodontist, and they want to do different techniques, it always comes down to what you do at home, because it doesn't matter how they treat your gums. If you don't follow up with correct care, gum disease comes back very quickly.
Hmm.
So the main thing, and even I did want to touch back about one of the students asked about having a tooth that was decaying for a long time. And I think later we're going to try and get some resources for that student. But cleanliness is the best thing to, if you can't reverse it, you can at least slow it down,
Mm-hmm. All right. There are more questions, but it's 2 o'clock. So I'm going to let you get back to that.
Yeah. Okay. Okay. Great questions, by the way. Good participation. Okay. So we're, as we said, 2 times 2, twice a day, 2 minutes. Okay. With the toothbrushing. I think that's pretty obvious. If for some reason you absolutely can't do it twice a day, nighttime is the most important time. And if you want to do more than twice a day, I know people who brush all day long, and that's fine too, but minimum. Okay, yes, flossing. Why do we floss? We floss because plaque and bacteria get between the teeth and under the gum line, and a toothbrush, no matter how good it is, cannot reach it. We have studies over the last 50 years proving this, and I try to get people to listen to me, because I don't care how hard you brushed. I don't care if you stand on your head and position your tooth bristles different ways, you cannot get to it. So when we're flossing, and I'll get to the different ways, tools and things you can use, but basic flossing. Okay, you're going to seesaw kind of back and forth just to break through that tight spot on a tooth. But once you're down between, you're not going to seesaw anymore. You're going to go. So we do something what we call making a C around the tooth. We basically wrap it, and then you can see the arrow pointing up, and you would go down with it again. So right here, it's down. up and down. And I do it times 3. 1, 2, 3. Come over to this side. 1, 2, 3. So seesaw it through, wrap it around a tooth, up and down 3 times, then move over to the tooth next to it, up and down 3 times. You want to do more than 3 times? That's fine. I get a little crazy and sometimes we'll go longer, but the reason we do it this way is you can see that they're actually sliding that floss under the gum line without cutting the gums. If you do the seesaw back and forth, it's like a knife. If you do up and down, you don't cut the gums, as long as you're using reasonable pressure. Now, I have seen people go in there and really mangle their gums up with floss. But if you're just starting to floss, there's a good chance your gums will bleed. Don't stop. A lot of people think, oh, my gums are bleeding. I have to, I'm hurting them. I can't do this. Well, if you're doing the correct technique, you're not hurting them, but yes, they're bleeding because they're not used to it. So if you will stick with it, within a week to 10 days, you'll see less bleeding. Okay, so here's on front teeth. See how they slid it up between the gum, just to the point of gentle resistance. You don't want to push it further and hurt anything. Many of you have probably seen these lovely floss holders, floss picks. You can buy a big bag of them at Dollar General. I love it. And I carry one in my pocket. Oops. But same technique, okay? Up and 3 times. 1, 2, 3. What you're doing is scraping the side of the tooth clean. I don't know why this slide is in there, but it's a good one. Drinking lots of water. We talked about the acid that plaque plus sugar creates. Water is a neutralizer. So if you will keep water going all day long, you help keep the acid levels down in your mouth. Kind of washes away stuff too off your teeth. All right, any questions before we go on to the infant and child oral care? I think somebody mentioned a water flosser.
Yeah, let me scroll back up to that question.
Yeah, to be honest, those are relatively new. I think they'd be great to stimulate the gums, massage the gums, probably would remove some food, but plaque is sticky. If you guys remember using that good old white glue, Elmer's glue in school, and you know at that stage when it's not quite hardened yet, but it's got kind of that film, that is what plaque. I cannot imagine shooting a hose at it and that coming off the teeth. It won't hurt to use a water flosser, but I would suggest also following up with regular floss.
And that actually answered the question, because it says, would you consider water flossing devices as effective, or should I stick to tooth floss? So you just answered that question.
Yeah, I'd stick to, if you're proficient with regular floss, I'd stick to it. I wouldn't change.
There's a question about tooth whitening options at home. Let's see. Looks like that's all the questions that I skipped over from previously.
Okay. Well, I'd like to address tooth whitening and veneers maybe at the end, since those are cosmetic, if that's okay.
Awesome. Thank you so much. And thank you, Maria N., for answering questions for me in the chat box that I've missed. I appreciate it.
Okay. So we're ready to move on to talk about our kids, which I know is a common denominator with all of us here. Very surprising to some, but early childhood cavities is one of the most common chronic diseases of childhood and is a public health problem that continues to affect babies and preschool children worldwide. It has a debilitating effect on development, speech, general health, and self-esteem, thus affecting quality of life for children. You'd think in our modern day, we've got this beat, but we don't. And there's a lot of reasons for it. But we're going to try to tackle some of those. So yes, even your children need teeth brushed twice a day. Now, it's hard to do 2 minutes on an 18-month-old or a 2-year-old. But if you can get at least 30 good seconds of parental brushing, and then let them have the toothbrush and let them kind of play with it and chew on it and pretend they're brushing, and they may even be able to brush some, but they are not going to be proficient at this till they're about 7, 8 years old. So let them hold the brush, So they feel like they're doing something, they get used to it, but we need at least 30 seconds of good parental brushing. And that comes from a pediatric dentist that I know. And then floss them, I'd say once a day. If you want to do twice, you can. But a trick that I always did with my kids is I would lay them on the floor or on the bed, because it's much easier to floss someone else's teeth when you're looking down into the mouth versus if they're standing and you're squatting and trying to look up and put your hands in there. Something very, very important, never, ever, ever put your baby or your child to bed with a bottle unless there's water in it, nothing else. And I'm going to show you pictures why in a minute. And like I said, with an infant, from the day you bring them home from the hospital or wherever you give birth, a damp washcloth, wrap it around, say, your 2 first fingers. And when the child is done breastfeeding or bottle feeding, you want to do like a sweep and clean out the child's mouth. It will, I know they have no teeth yet, but a child can get thrush, which is a yeast type infection in their mouth if their mouth stays dirty. And this also teaches them that cleaning the mouth is going to be a regular part of your life from day one. And my other comment about on that is don't kiss your children if you get those oral mouth ulcers. That doesn't mean ever. Just if you feel one coming on or you have them currently in your mouth, don't kiss on your children. And that's really hard. But yes, those get passed on to children from parents. And then the little bitties, newborns, all the way up to the age when they are able to spit really well. Children's toothpaste is good. It has fluoride. It tastes good. It is not as strong as adult paste, so it won't hurt them if they swallow a little bit. And most of all, fluoride can be dangerous. In large quantities, it's toxic to small bodies. So keep your toothpaste somewhere where little kids can't get to it. There have been rare instances where small children have gotten hold of mom or dad's tube of toothpaste, thought it tastes like candy. They start eating it and they wind up in the hospital. So the most important thing about the little ones with their mouths, and even when they just are starting to get teeth, is to get them clean, and the toothpaste you can incorporate in later. Okay, the reason you never ever put a baby to bed with anything but water is something called tooth bottle decay, or bottle tooth decay, excuse me. And this is what it looks like on the little ones. And unfortunately, my mom didn't know and did this with me. And I had cavities at age 2 that I had to have filled. And that's not easy to fill. What happens is that milk, juice, whatever it is going to sit in their mouth all night. And the mouth is still, the mouth's not clean, and they wind up developing caries or cavities. So not a good start for our little ones. Okay, diet and nutrition, very important for kids' mouths. I always say limit milk and juice just to meals if they're drinking from a cup. And then the rest of the day, water is really the best thing, or something unsweetened. Try to limit anything with sugar, particularly sticky. You know, fruit roll were a big deal, came on the market when my children were little in the 90s, and everyone thought they were so healthy because it had the word fruit in it. But they're so sticky. And gummy bears are so sticky that that sugar just grabs onto the teeth and it can rot them very quickly. And I always say, just because they ask for it does not mean you have to give it to your kids. I have parents who would come in with kids with so many cavities and they'd say, well, she likes candy. And the kid's 6. And I'm thinking, well, the kid can't get candy at age 6 unless you provide it. So find other snacks that they like. Offer them an orange, an apple, popcorn, nuts, cheese, something else. Sweets should be a treat, a rare treat. Then if you can, take the child to the dentist twice a year. I know Peach Care has some dental coverage. There's a couple of public health clinics around that I can recommend. And also the dental hygiene schools in town. There's several, and you can take your child there, not for free, but very, very reduced rates to get at least a cleaning and checkup and an evaluation. And then if they have problems, they'll refer you to a dentist, because fluoride treatments and sealants on the kids that are age 6 and over are very important for preventing tooth decay in the future. Okay, I know we're running out of time, so I'm going to talk about gum disease fairly fast, but it's an infection of the gums and the bone in your mouth, and it results in tooth loss. And there's 3 different kinds. Gingivitis, which is the most common, a lot of us have it. Periodontitis, which is full-blown gum disease, and then gum recession. It's caused by poor oral hygiene and diet. Genetics play a role in it, and systemic diseases play a role in it. All right, this is gingivitis. Okay, remember I talked about the knife, sharp, pointy gums? You see how round and bulbous this is? In between each teeth, I would say this person probably doesn't floss because it's in between, and very red looking. And look at this, very acute redness. It should be more of a pink. More advanced gum disease, we do see this darkened. This is called tartar. There is no pointy gum between because it's gone. It's eroded away. And I would guarantee these teeth are probably a little bit loose at this point. And then gum recession, when the tooth kind of looks longer than the other teeth. You can lose teeth from tooth recession, but you also can, this can be treated, it can be stopped. I've had recession on my front 2 teeth like this since I was about 10 years old, and it hasn't gone any further. So it's not been an issue, but there's some recession there too on the upper canine. This can be sensitive right here. You might drink something cold and say, ouch. And there are toothpastes we can give you to help with that if you use daily will reduce the sensitivity. Gum disease is linked to systemic diseases. Bacteria in your mouth enters the bloodstream through the damaged gum tissue. So all that red fat gum tissue we saw is weak. And the bacteria in your mouth is entering into your bloodstream very quickly through that. It can weaken your immune system. More likely to have things like COVID, flu, pneumonia. It's related to heart disease. We have found something called P. gingivalis, which is one of the major bacterial components in gum disease in people's arteries of their hearts. And diabetes, which persons with diabetes have poor healing ability. So it perpetuates the gum disease, and the gum disease perpetuates the diabetes by adding more bacteria to the bloodstream. So there's more to it than just brushing your teeth and looking pretty. So research suggests that bacteria that cause the inflammation, that redness in the gums, can get into the bloodstream and target your unborn baby, potentially leading to premature labor and low birth weight babies. And that comes from the National Institute of Health. That's a fairly new concept, but research is really backing this up, that your oral health, even before your baby is born, can affect them. Oral cancer, 3 signs: a sore throat that does not go away, red or white patches that don't go away, or persistent pain or tenderness when you swallow that doesn't go away. And I mean like 2 weeks. If it doesn't go away in a day or 2, I wouldn't panic and say, oh, I've got cancer. But if something persists 2, 3, 4 weeks, then you need to go get it checked. These are pictures of oral cancer here on the tongue, which very common spot. Down in the cheek, because people use tobacco and they shove it down in their cheek, and then after a while it creates that. So primary causes are tobacco use, but we're also finding vaping is causing this. And I know vaping is very popular in the younger generation because they feel like, well, this is safe. I'm not smoking and I'm not dipping, but it's not safe. It has its own negative effects in the mouth. There's tons of chemicals, metals are in there. The heat from it causes dryness and irritation, and some of these flavored vaping juices have sugar in them and cause your teeth to decay. The effect of e-cigarette vape on fancy words, oral cell proliferation. Basically says that the skin cells in your mouth, your gums, your cheeks will grow abnormally when exposed to the heat and the chemicals. So vaping is no safer. It's just different. So what can you do? Eat healthy foods, all natural things, less sugar. Drink lots of water throughout the day. Clean your mouth twice a day. Quit smoking, vaping, dipping, chewing. Go to the dentist twice a year. Go to the dentist when you have pain or a suspicious spot in your mouth that doesn't heal after several weeks. And get to know your mouth. Look in the mirror. So many of my patients had no clue what was beyond those front teeth when they smiled, but get to know what looks normal for you. If normal for you is, it looks different than normal for me, that's okay. The important thing is you know what your normal is, and if it changes, you know to do something about it. And this is one of my favorite things. I'm telling you to chew gum, but I want you to chew gum that has something called xylitol in it. And luckily, one of the main brands, Trident, has it. Not only does it make you salivate, so there's more water, more neutralizing in your mouth, that ingredient, xylitol, actually strengthens your teeth. So, like some of my patients who are elderly and they get a dry mouth from taking a lot of medications, they all want to suck on hard candies and their teeth will rot. I've got them changing over to chewing gum with xylitol. This is a good website if the students want to write this down. If you'll go to www.colgate.com/en-us, there's an oral health tab. And it's going to give you options on your children's teeth. You can see the development at different ages, all kinds of really, really good information to answer some of your oral health questions about yourself and your children. And I always make a pitch for career paths. Being in the dental business has been very good to me. Being a hygienist is a great career if you're still looking to find what you're going to do in the world. I have an associate degree and I later went back and got a bachelor's, but worked many years with a 2-year degree and had great hours, flexible hours when I was raising my children, good money, good benefits, and wonderful relationships with patients, and knowing that I was helping people with their quality of life. So that's my pitch about that. Now go succeed and be healthy.
I am going to go back to the questions, but I do want to say to the students, she is not a pediatrician. She's not a nutritionist. She is here about oral health. All right. So the first question I skipped over, when can you start giving your baby water?
Oh, you know what? I'd ask a pediatrician because that has changed over the years. When my kids were newborns, they had me giving them a bottle of water once a day with fluoride in it.
Yeah, that's definitely.
And that changed when my daughter had her children. So ask your pediatrician. Yeah, it's always changing. So
it is always changing. Let's see, please recommend Peach Care around Cobb County. I would like to visit. We're going to be giving out resources, y'all. Do infants need to see dentists twice a year?
no, unless they're acting like their mouth hurts, if they can't eat. But no, pediatric dentists are now saying take the kids at age 1 just for kind of an initial, just quick look-see visit. They're not going to really do anything. And then by age 3, we try to get them in for cleaning, checkup, fluoride, and get them on a regular twice a year.
Oh, that makes sense. This is very specific. Does chlorhexidine rinse help gingivitis?
Yes, it does. But there's some things about chlorhexidine you need to know and how it works. You're not supposed to use it every day, 365 days a year. It's meant for limited treatment. So if you use it for 3 weeks or a month, then you go off it and give yourself a break before you go back to it or switch to something like Listerine. Second thing about chlorhexidine, it's an antibacterial. It's actually the stuff in a lot of the antibacterial soaps that they use in the hospitals. It has the side effect of leaving a little bit of stain on your teeth. Now, the good news is that stain can be removed in the dental office. You can't. But the stain is byproduct of dead bacteria. So if you have a lot of stain, it means you had a lot of bacteria in your mouth. You have a little stain, well, you didn't have so much. So it's kind of an indicator, which is a good thing to know, am I brushing and flossing well?
Mhm. Is it true that during pregnancy, your gums can bleed more?
Yes, and that's a good one I should have actually just brought up. It's all the hormonal changes, everything that's going on in your body is changing. And the main thing is to keep your mouth clean so that after the pregnancy, the gums will stop bleeding and go back to normal.
Wow, phenomenal. Oh, thank you so much. Before we end the session, please feel free to unmute yourselves, ask some questions, because this has been eye-opening for me. And I go to the dentist twice a year. So please, y'all, this is your chance to ask an expert what you want to know. So go
Yeah,
right
there's
ahead
only
and
so
ask.
much we can teach at a hour-long dental visit, So,
Exactly, exactly. So y'all, this is your final chance. We got a couple more minutes. And we appreciate Miss Reese's time. Go right, somebody just unmuted themselves. Go right ahead.
go ahead.
So how do I help get my child's mouth open? Because when I try to wipe out her mouth, yeah, it's not a success. She doesn't like it.
Not working. How old?
The only time I think I'm able to maybe get something in her mouth is like, say if I'm bathing her and maybe water splashes her way, she'll open her mouth. So I'll try to stick my finger in her mouth with the rag. But yeah, she doesn't like it at all.
How old is
It's
she?
like
I'm sorry.
8 months tomorrow.
8 months. Oh, that's sweet age. All I can suggest is keep trying. It's not the end of the world if you can't get in and do it perfectly. Thank goodness God gave babies a lot of saliva. They drool, and that saliva adds cleansing, natural cleansing. And I think that's because, God knows they're not going to be able to get their mouths thoroughly clean for a few more years. So just do the best you can. It sounds like you're doing a great job, but don't get her uptight. What we don't want is for her to hate it. And then as she grows older, never wants anything in her mouth. We want to make cleaning the mouth fun for kids.
I was just about to say, from a psychology standpoint, do not traumatize that child, or else
No,
it's
no, it's not
later.
worth it.
So
Okay,
yeah.
I won't. So is it safe to use the toothpaste that says for 0+ months or something like that?
I wouldn't put any toothpaste in an 8-month-old infant's mouth. I would wait, even if she has teeth, I wouldn't use it. I would wait till at least age 1, or every child's different. The big thing is we don't want them swallowing a bunch of toothpaste. So if your 1-year-old can spit in the sink, that's great. But if not, I'd hold off. But keep up what you're doing. You're doing the right thing, and eventually you'll get there. You'll get there with her. Good job, Mom.
Should the tooth filling be changed after a certain period of putting them in? I'm assuming like with a cavity filling is what the person's talking about.
Yeah, there's no set time. Cavities can go, fillings can last 50 or more years. I've seen it in people. It all depends how well you take care of it. So it's not necessarily like, oh, I got a filling yesterday, I know in 5 years I got to replace it. No, that's not how this works. You could possibly have that filling the rest of your life.
Is it okay for me to use the rubber bristle brush on my 11-month-old?
A rubber bristle brush. I'd say if they can tolerate it and you're not gagging them or scaring them, it'll be okay.
We've got a ton of thank yous in here
Oh, sweet.
because
I
this was
appreciate all the
very useful
questions.
information. Let me see, you got a couple of things popping up. Yeah, it's just a whole bunch of thank yous.
Oh, that's
Which
so
one
sweet. Well,
was-
someone asked about veneers and whitening. Should I address that? I don't know what the
Yes, please.
questions were.
The question about veneers was what
Both of
are
those
your thoughts on veneers?
thoughts. Well, I have some because when I was young, I got too much fluoride, and my teeth, when they came into my mouth, were all malformed. So I've had veneers, so I'm a proponent of veneers, but they are cosmetic. It's totally elective. They're expensive, which is why I haven't had mine redone. So it's just up to you. If you want to do veneers, go for it. They're beautiful. The ones they do nowadays are really beautiful, but It is totally cosmetic. And then same thing with whitening. You don't have to have white teeth, but there are some over-the-counter products. The Crest white strips, I personally like the best. If you stick to it and do it the way it says to do it, exactly the way it says, the only promise, some people are sensitive and you may do the whitening and then your teeth hurt when you eat ice cream or drink something cold. And if that's the case, then you have to back off, and eventually the sensitivity goes away, or you can get a toothpaste called Sensodyne and use that until the sensitivity goes away. But those are good products.
I will say about the veneers, just want to add, because I know social media is a huge thing, y'all.
Yeah.
It's just like a BBL. It's just like lip fillers. Sure, you are researching who you want to go to for
Absolutely.
veneers. Okay, don't just pick somebody because they got a $99 sale. Okay,
I'd stay away from them.
I need you all to research. This is your body. This is your lives here. So for
Absolutely.
anything you do, please research.
Yeah, and I'll say after being in the dental business for 38 years, you generally get what you pay for. But not always, there's exceptions to that rule. But if you're going to, folks, I've had patients say, oh, I heard I can go get a whole set of dentures for $199. Sure, you can get a set of dentures. Are they going to fit well? Are they going to be correct? And some people do that and they just live with whatever they wind up with and they're happy, and that's fine. But just know if you want it done right, you don't price shop for a good heart surgeon or neurosurgeon or you know what I'm saying? This is your body. So and most of the students I think are probably young women. You probably all have prettier smiles than you realize. Don't let social media drive you into thinking you got to have that stuff. So
well, thank you so very much.